Today I'm going to talk about what are the treatment options that are available at a fertility center. Hello everyone, I'm Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. So the treatment options which are available at a fertility center will start with the basics. First and most important thing is evaluation of both the partners. That is the couple which like the wife and husband, both partners should be evaluated at the same time. So the complete evaluation of both the partners will help us to come to a conclusion. So the first facility which is available at a fertility center is complete evaluation of the couple. So second treatment, now coming to the treatment options. So option for the treatments are, we start with the basic, like to try naturally. If the couples want to go for this kind of treatment where they're young, both of them are young and they're just recently married, they have not done any treatment, then they can try naturally, what we call it as follicular monitoring and timed intercourse. So that is the most basic treatment. Now going to the other treatments. So if somebody is not conceiving despite of having regular intercourse as per their ovulation schedule, then or if at all we find any issues in their evaluation, then we suggest for the fertility treatment. So these treatments are like basic one is IUI or intrauterine insemination. Then after that is IVF, that is in vitro fertilization or test tube baby. So first we'll talk about IUI. So what is IUI is, we give some medications to develop eggs. Once the eggs are ready and we document ovulation on the scan, we take husband semen sample, we process it in the lab and we separate fast moving sperms from that sample and put this fast moving sperms inside the uterus at the time of ovulation. So this is called as intrauterine insemination. So if you have trying naturally and if all your other reports are normal, then the doctor may suggest you to go for an IUI. So success rate with IUI would be somewhere around 15 to 20%. So if the doctor is suggesting you an IUI, you may have to consider doing it at least 3 to 4 times. Now if suppose this IUI has also not helped, or in evaluation certain factors are present where the doctor feels that the IUI may not give you pregnancy, then in that case what we suggest is IVF. IVF or test tube baby is a technique where we give gonadotropin injections to the lady for 10 to 12 days. Once the eggs are ready, we take out the eggs from to the outside. In the lab, we combine each egg with each sperm from the husband. Once the embryos start developing, we observe them in the lab for up to 5 days. Then either we freeze the embryos or we put back the embryo into the uterus of the lady. So this is the process of IVF. Suppose if you have already done IVF, then what is further? So what are the other treatment options at an fertility center? So we need to find out the cause for the failure of the IVF. So the cause can be either related to the embryo quality, it can be either in the egg quality, sperm quality or uterus, or it can be a combination of multiple factors. So once the evaluation is done, then there can be the treatment options. So the treatment options could be either going for like advanced techniques in IVF like PGT, that is the embryo biopsy and selecting a genetically normal embryo for IVF, or it can be something like ESHRE assay, that is the testing of the endometrium to know exact the time when we can put back the embryo where the chances will be better. So PGT, ESHRE, these can be the options to improve your success rate. So in PGT also there are different types of PGT based on what is required for that couple. We advise that particular genetic test for the embryo. So then again there are other options like helping the embryo hatch by using laser assisted hatching, use of other adjuvants like embryo glue or other techniques wherein sometimes if the lining is on the lower side, we need to improve the lining of the uterus. So we suggest to go for hysteroscopic subendometrial PRP. So wherein a PRP injection is injected below the layer of your endometrium so that it is stimulated for better growth. So these are various techniques what we use to improve the success rate of IVF. Suppose if somebody has very poor egg quality or very poor sperm quality, or there are no sperms even at teaser, or if there are no eggs, somebody is already menopausal, then for such patients we may advise to go for donor services. So what are donor services? So there is availability of donor egg in donor services and also donor sperm. So we have to follow the ART law that has been set by the government of India. So what we do is we procure the matched semen sample for the couple if they are opting for donor sperm from the ART bank. If the couple is opting for egg donor, then we provide the matched profile of an egg donor for the couple. Then that donor is stimulated in the ART bank and we provide the donor eggs for that couple. There can be an option of going for donor embryo as well, wherein the egg and sperm both are taken from the ART bank or from the donors. So these are the various donor options: donor egg, donor sperm, or donor embryo as well. Then there are other options for women who have either contraindications for pregnancy, like severe medical conditions like heart disease, or if they are not physically or medically fit to carry a pregnancy, or if they have had multiple IVF failures or multiple miscarriages or multiple deaths of the or intrauterine deaths of the baby, wherein their uterus is not able to carry the pregnancy to term, or they are having some issues with the uterus, like it is damaged uterus because of multiple fibroids or because of tuberculosis or because of multiple adhesions in the uterus, or sometimes the uterus may be absent or having some problem while developing, it is not developed properly. So such patients who may require surrogacy, for those patients surrogacy option is also available with the fertility centers. So if you have any queries regarding this, like what could be the cause of fertility, what are the different options for the treatment, and which option amongst all these is best suitable for you, then you can approach me. I'm Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Thank you.